Can you give us an idea of how the fire department is sort of tackling this outbreak and what measures are being taken to protect the crews?
Well, the Los Angeles City Fire Department continues to deal with this global pandemic. It's really unlike anything we've seen before. So we are working tirelessly to ensure that our members are informed, that they have the proper equipment, that they're updating our procedures and policies for them, because they're really the first line of defense to protect the city of Los Angeles. So in many ways, it starts at our 911 dispatch center, if you think about it. So we started early on in January, continually updating those policies to have our dispatchers ask questions to determine possible coronavirus patients. And then the important part is they would then notify our members that are responding in an engine or an ambulance before they arrive on scene, so they don the additional personal protective equipment as needed. So speaking of that, you're going to see our firefighters, even on their routine medical calls, now start wearing the mask. We always like to wear eye protection and gloves. So additionally, you're going to see us hand a mask to the patient to be wearing to really reduce that transmission. And we want them to continue to wear that mask as we transport them to the hospital. But another new thing we've done is we're calling it a one in, one out rule, and we're maintaining 6 feet of distance from our patients while we're performing an assessment. So you'll see maybe just one firefighter come inside a house or to talk to that patient, and the other firefighters will stay at least 6 feet or more away. Now, of course, if the patient is unstable, we're going to come right in and handle that immediate need. But ultimately, if we then believe that that patient is at a high risk based upon the patient assessment that we are performing, we're going to go back outside, have another firefighter don that gown on that firefighter that was performing the assessment. We're probably going to call for another medical captain to arrive on scene. They're really the subject matter experts. They're going to help with determining patient transportation, destination, and things like that. We've even given some instruction to our ambulance drivers on how to carefully take this personal protective equipment off before they get back in the ambulance so they don't contaminate that compartment, how to make sure that the ventilation is pushing all of the air outside or away from the ambulance driver. And these policies and procedures are actively changing as this pandemic changes.
And in the video, we saw the temperature monitors. So did you also mention that?
Right. That's some of the changes that are happening at our fire stations. So, first off, we had to limit that there's no longer visitors allowed at fire stations. We want to really limit exposure, reduce the transmission. So another big part we're doing is testing their temperature every day. To ensure that they're not febrile. So if they have a temperature of 100.4 or above, they're going to be sent off duty sick. And we have very, very close coordination with our medical units, the CDC, LA County Health, etc. And a big part of what we have to do at the fire station is, because it's really a communal lifestyle at these stations, right? And of course, our firefighters are frequently coming in contact with high-risk populations. Then not only are our firefighters at an increased risk of exposure, but subsequently they could bring that back to the station. So we're making sure that we're having disinfecting take place at the fire station twice a day. So not only are our firefighters told, hey, make sure you wash your hands, avoid touching your face, but we want these hard surfaces cleaned. Like bathroom counters and sinks and handles and doorknobs, fitness equipment in particular, TV remotes, etc. Also on our apparatus, of course, those are going in and out to the different scenes. So we're looking at the steering wheels, the headsets that we put on, our radios, in addition to those mandatory temperature checks. So we're doing everything we can at the station to ensure at that level our firefighters are safe as well.
So I know that you mentioned that calls are down. Not as many people are calling 911. Obviously, people aren't out and about. Fewer people are on the road. So can you attribute the reduction in 911 calls to anything?
Well, first off, we run about 1,350 emergencies every single day in the city of Los Angeles. So that's just over about 9,500 a week. So last week we did see just about a 2% decrease in emergency incidents overall. And we saw, surprisingly, a 20% decrease in hospital transport. So to answer your question, we equate that to a lot of people that are heeding the mayor's warning to be safer at home. They're really being aggressive about their hygiene. They're practicing safe social distancing. We're not seeing as many people on the roads. Therefore, we have a reduction in traffic collisions, and all of these things add up to seeing a decrease in the overall calls.
I guess I'm just surprised that the number of 911 calls are down, because I would think that with so many people trying to get tests, they would be calling, trying to get that information from maybe 911. But that hasn't
That's
been
a good point. And what we've done is taken proactive steps to remind people to use 211, not 911, to determine testing information.
And just a quick note on what you said earlier on with the protective gear. So if you do call 911, you'll see a difference in the paramedics that are coming and what they're wearing. Do you guys have enough of that equipment and protective gear?
Yeah, it's a good question. Obviously, that's a concern to make sure that our members have the correct quantity and type of personal protective equipment. And right now, we're pleased to say that, yes, we do.
As far as this coronavirus actually affecting the fire department, what kind of numbers do you have right now? And is it better or worse than you expected?
It's continually changing, but as of now, I believe it was last Friday on the 20th that we started having testing available for all of our firefighter that have exhibited signs or symptoms. And so at this point, we've tested 79 that have had those symptoms. As of right now, we do have 2 of those tests that returned positive. Fortunately, both of those members, they're off duty and they're doing well. And inevitably, we're going to expect to see that number increase. But that's why your Los Angeles City Fire Department, and in particularly Fire Chief Terrazas, has been truly leaning forward to ensure that all of those on the front line are well informed, that they're prepared, and that way we can better serve the public.